technologies and technologies. Today, we are going to give you a minute so that everybody is properly set in the corresponding room for a special day today. I will be explaining what it's all about in a minute for this 46th edition of our webinars and RedETSA, ETSA. So I want to remind you, we have simultaneous interpretation in channels. We have the floor, we have English, Spanish, and Portuguese. We are taping, we are video recording this session, and will be available as all webinars in that's a webinar page and YouTube channel of PAHO. Today, we have the topic that is displayed on the screen, um, assessment for medical device, HTA medical devices. We will have engineer Adriana Velazquez from OMS, Blanca Novella SERMAS from Spain, and assessment of Santa Technology from Madrid, and Victoria Hurtado from the Health Ministry of Chile's assessment unit that is coordinated along from Gallego from Mexico, the task force on medical devices in Chile. Those will be our speakers today, and I would like to thank you for your attendance and also to thank our local team of PAHO, to Malane, Hurtado, Caroline, and to Lisette as well, who is always supporting us in webinars. Many thanks for the hard work you have been carrying out to put in place this webinar. I just was saying that this is going to be a special day because it, it's always special to have this type of webinars. So from this, we have over 200 persons, attendees in the room. And we have a special day because I can get a little bit emotional. Apologize me for that. Well, because we have a speaker, a colleague and friend of many years, Engineer Adriana Velazquez from OMS, World Health Organization in English. And we are going to have a special day and the topic of medical devices, because as you know, perhaps Adriana was always a leader in the topic of medical devices in Mexico, regionally across the Americas as well, and even global, worldwide. Adriana is about to leave. She's becoming a pensioner, and we have thought about we thought about conducting this like a little uh, a celebration to uh, thank the professional career of Adriana. Most of us who are here connected know Adriana for many years now, and you know that. But I have a kind of personal reason for that. And before we start formally our webinar, I'm going to ask you a little bit of patience because this is it, it's yeah, kind of sour sweet to say, because we are celebrating a wonderful career for Adriana, but at the same time, on the other hand, we're going to miss her on a daily basis. We'll be in contact, of course, and she will be continue cooperating, uh, but on the daily basis, we will be missing a lot uh, because of her energy. Diana, for me, is kind of a model. I always work in public service as a public servant in Brazil with PAHO, and always I admire Adriana because I think that she gathers all essential characteristics that for a person that is totally dedicated to public health. I mean, dedication, passion, commitment, ethic, and Adriana has been always kind of an engine that has worked restlessly uh, for for making sure that the contribution to public health for the benefit of population around medical devices. In few minutes, I will be reading kind of a facial communique about that, but I wanted to provide this personal opinion first.
Trajetória profissional de Adriana,
But
queria dar testigo personal, porque
apart from talking from the professional career, then I want to give this testimony. Uh, when I see that a person is causing impact as a result of her the work of that person, not only professional, but it's an impact on persons, over persons with that she has been in contact. I'm going just to mention one that always, let's say, impacted me, and that's the reason why I'm so grateful for Adriana. All of you who know Adriana know that energy is full of energy, totally dedicated in everything she does. A meeting in Geneva, and Diana was having paperwork and participating in debate. There was a lot of people in that meeting, by the way. And in the middle of the meeting, I was a participant there. In the middle, I received a phone call from what my daughter has gone a serious health crisis. She was already on the way to hospital in an ambulance. And at that time, that moment, I was really didn't know what to do. I wanted to go to home immediately. And Adriana stopped everything she was doing, everything, all presentations. And she took me by hand to the travel agency. We changed the return ticket, itinerary. She took me to the airport. I let's say that in an hour or less, I was aboard an airplane, and I left everything behind and check out the luggage, etc. I wasn't carrying my luggage then, but she returned to my hotel. She packed my clothes and luggage. Uh, She did the checkout and sent the personal belongings to Washington. So this is a personal testimony of my appreciation for Adriana, and because I believe that it's really a sample of the human character and personality she has and how everything in her combines, you know. And that I believe that a person dedicated to public health should have that professional component, human component. So I wanted to leave that testimony with you. The, my working relationship with Diana is pretty long, so we don't have time for that. But Adriana Velazquez has over 40 years of a passionate delivery of herself to technologies that are but for the vulnerable population by medics and clinical. She has been a key figure in the strengthening of capacities related to medical devices, assessment, regulation, management of medical devices. She started her career back in the 1980s, uh, planting and inspiring thinking created uh, around this in the Center Technological of Excellence, and even worldwide, she was a dedicated person, and and many of her functions and suggestions are in place right now around the world. We never forget when Diana started at Genetech in 2008, she assumed the responsibility of the entire technical cooperation of medical devices, supporting, leading, coordinating over 40 technical tools of oriented WHO and the use of this, including the resolution about the use of medical devices, scientific technologies, uh, capabilities needed, and access on part of medical staff, and nomenclature of medical devices, among other things. She led also the development of information systems for medical devices, MEDEDES, that includes over 2,000 medical devices and are essential reference for all of the people who work in medical devices. She led the technical series of medical devices since 2011 that include the complete lifespan of policies, regulations, donations, acquisitions, maintenance. um, withdrawal of use equipment, etc. She also worked in the compilation of information area of medical devices since 2010 and conforming the World Atlas of Medical Earth. She led the compendium of innovative technologies, especially with limited resources, and also the creation of a model of in vitro devices that are essential right now. And as you know, she led as well the document about assessment of sanitary technologies applicable to medical devices that today will be the topic of the presentation of this webinar. So I wanted to really leave these words, my humble words of homage, that really are not enough to describe what Adriana has done in all the years of her professional career. But of course, I want to leave this testimony, and I want to leave you with Mariluz Pompo, our director, so that she can also express her words of appreciation. So, good morning, or good afternoon, depending who are here with us. I am Mariluz Pombo, and before being the interim director of the Innovative and Access to Medications and Sanitary Technologies of PAHO, just one more colleague, part of this enormous team, and Adriana, who has been with us for many years now, and that we hope will continue being with us in some way. I connect myself to this especially, not only because of my functions of my PAHO, but because I know that this is was going to be a special moment. Not always we have the opportunity to have women so smart, and that besides her charisma, professionalism, empathy, and collaboration is really what characterizes in her the everyday work. And my opinion of Adriana, just to say to a phrase that I think shows what she is characterized as, that she has never forgotten where she comes from and to whom she serves. And for that reason, today, Adriana, well, it's a pleasure to be hear you in the topic that you will be presenting within the framework of this webinar of worm. But just to let you know that we love you and that we always will have you in our hearts. We will count on you. Hugs and big success for coming years. Many thanks, Mariluz, for your words. And I will go now to Pablo Jimenez, that you know, and for being for an OPS for many years. He's worked with Ariana as well. Yeah, many thanks, Alexandra, for the opportunity. Yes, really, this is a quite relevant moment. It's quite difficult to add something else on top of what has been said about Adriana, her dedication, professionalism, etc. So, what you were talking, I was thinking, what can I say? And taking advantage that we have the entire group just to rescue some contributions that have been quite important in the areas where I work that have not been mentioned. Topics with radiology uh, and the related topics. I was lucky enough to meet Adriana when she was still in Mexico, and regional meetings carry out in Washington with and I was also in Mexico in CET with the creation of. Had the opportunity to visit and witness the entire process when she went to Geneva, and the first resolutions were put in place about um, sanitary technologies really all that time. But in radiology, she was also a important contributor because she knew very well how radiology fit in all this radiotherapy, etc., and the form apart, the relationship with different sectors. I think that we can rescue several moments apart from those pleasant moments. Forums in Bangkok and Geneva, and different meetings, for instance, in the World Congress of ESP in Toronto, and several occasions. So many that it would be impossible to mention them all, but especially in the topic has been working, I think it's worth mentioning that. even if, well, it's the last, it's not to say that it's not important. The resolution, image only, just diagnostic images that has been produced this year is quite important. It's the last, but of course, it's equally important. And that shows the right capacities, everything around him, diagnostic images, everything that's, I mean, it's impossible to summarize. It's just to rescue a few brilliant moments. Personally, I want to thank Adriana for everything she has done, for the support she's always given us. The World Day of Radiology, had been with us connected, and that is a legacy, reality, so relevant that it will be difficult to forget, and we hope we can count on you in the future. And so for me, it's also a sour, sweet day, but let's be happy, and I'll send you a strong a hug. So many thanks, Pablo. And before we go into and start our day, is some of us in a Bajo team, we cannot speak all, but I'm speaking on behalf of them. But I want to give the opportunity at least to one person from one country that can speak on behalf of the rest of the countries that have been impacted as a result of Tatiana's work. So I invited uh, mm, a friend of many years now and a friend of Adriana too, Pedro Galvan from Paraguay, who is with us today, and I'm going to ask him to open his microphone so that he can, yeah, contribute with his words.
Olá.
Hello.
Hola, ya le di acceso.
Adelante, Pedro.
Hola,
Pedro,
hola.
please, the floor is yours. Hello, can you hear me? Well, first of all, it's as we heard before, it's a sad but a joyful day at the same time, because it's sad because we are missing Adriana. Is a person that we cannot fully describe as a woman, as a spouse, as a friend, and of course a world reference. Uh, Pretty emotional about this, and we I know use this uh, because Adriana cannot be replaced that easily, as we said before. She never stops, she never gives up, she never surrenders. And I don't know how she's been doing all what she has done in recent years, and the times that was a member of American College of Engineers when she went in with enormous view and for the Americas. And for us, Chandler Liu, that is one of another good example. But because she was the biomedical engineer in charge of disseminating around the world, not only across the Americas, but worldwide, about the importance of the engineering applicable to the health sector, and also help to show that the capacity of Latin America in comparison to the rest of the world is excellent. And she is precisely the person who represents that. And working for many years and more closely in the past 5 years, when we have been collaborating with WHO hand in hand with her, so that we can really not only benefit, as she said, to the most unprotected people who can enjoy the benefit of engineering and technology applied to medical research in our countries. A profound pain because we are not going to have her clothes anymore. But I take this opportunity, as the saying goes, we need to say that while we are alive, and to Alexandro is another excellent pioneer in all this. Two dear friends that I will have always in my mind and heart. Collaborator of yours, and as Adriana said yesterday, she is just a warrior, and she's just ending this battle, but not the war, because I know she will be continuing with us. But she will be always dedicated to the good part of her life, the husband and children and home. But judging for what she's been doing in the past, well, she will be successful in that. She will need to recover all the time for her home, time that was previously dedicated to her work. Thank you, and thank you for you will be an example for the world and especially for Latin America. We will always have you. It's a milestone of what biomedical engineering is around the world, especially here in Latin America. Thanks for everything, and to you, Alexander, for giving me this opportunity. Thank you, Pedro. So I'm going to floor to Adriana for brief comments. And so I know that all this is quite emotional, but I'm going to leave her with the comments and address the 300 people that we have right now connected. And after that, we are going to uh, um, I'm going to speak a little bit about our agreement with Spain and then Blanca, and then we will go straight into the presentation. So, Adriana, please, the floor is yours. Many thanks, you all. A lot of emotions at the same time, so please apologies for that. I can't hardly speak. So, first of all, thanks to all of you, Alexandre, Mariluz, Pablo, and Mero, who's here with us as well, to all of you, really, because been many years of close collaboration, many years of doing a lot of things together, quite emotional for me, and I agree with what you're saying. This is kind of sour sweet, yeah, but something like that you said. Mm, I cannot really speak more about this, but just to let you know that it's been a collaboration of all of us. You cannot do everything by yourself, alone. You need the help and the collaboration of others. Pajo, I love a lot, and we'll be together, not inside, but maybe outside, but we will continue collaborating with you. And as I've said recently, I'm not going to desist and never give up here in this. Uh, I'm not going to desist. I'm not going to uh, quit. We will continue working so that technology is the best thing, especially for patients that need the technology. And in that sense, and perhaps you remember, I present my white pen. Everything that we do is for the patient. It's not really for us or for bosses, etc. We do everything we do for with love. So an embrace for all of you, and yeah, really interested, emotional, sad, but many emotions come into the same time. But I think what you said is a good idea. Alexander, give the floor to my collaborators, and I hope to visit you in Washington soon or in any other place around the continent. So, million thanks for everything. Really appreciate that. No, thanks to you for everything, Adriana. So, to leave Adriana to recover her breath, I'm going to leave you with 1 minute with a Blanca. Um, but I want to take the advantage of this opportunity, thanks to the presence of Blanca, besides being from the agency, Tiny Sanitary Technologies, and assessment of sanitary technology. She's also the VP of the Spanish Network of Sanitary Technologies. And I take this opportunity to share with all of you the uh, excellent good news. July this year, MOU was signed between PAHO and the Ministry of Health of Spain with the intention of strengthening the assessment of sanitary technology for decision-making process. Barbosa from PAHO and Dr. Monica Garcia, Minister of Health of Spain, signed recently in Seville this MOU, a formal MOU of collaboration between RedETSA and RedETS, which is the Spanish network, have been working together since 2022 on key initiatives for the technical development of ITS with the support of our Department of ETS in PAHO, Sanitary Technologies, and revision by RedETSA and the publication and RedETSA of reports on adaptation of tools. One of those publications included the financial support of Spain for the participation of 31 representatives coming from 6 countries in the National Congress on Assessment of Technology, the incorporation of over 400 reports coming from the Spanish network that were director or joined the reports of Latin America called BRISA that exceeds now 4,400 reports. papers, really. And this shows how the collaboration of material publication, reports, and exchange of professional really is going to strengthen this close ties of collaboration between the two networks and represents without doubt a significant improvement in making the health sector more efficient. That's our commitment from PAHO and the Ministry of Health of Spain to have universal health based on evidence. So with that, we are celebrating that MOU on cooperation, and I will invite now Dr. Blanca Novella so that she can start with her presentation. Blanca, the floor is yours. Many thanks, Alexandra. Many thanks to all of you for thinking in networks and to share with you this presentation. And of course, to be with you in this such an intimate moment, so emotional. To thank you who have facilitated me participation in this webinar and to the network, chairman of the network, unfortunately had not be with us, so thank you for allowing me to address you, and to Nila Juarez, the one who has compiled this information and given it to me so that I can present it to you. So, because the webinar is called ETS for Medical Devices, Focus on Current Challenges, I think that it was appropriate to do kind of summary for those of you what is not read, especially in a moment like this, where RedETSA and RedETSA always work together. Even more since 2022, as we heard, now has signed a collaboration MOU that involves the Health Minister of Spain and facilitates that we can continue working together. So the best thing is to get to know each other. I will be telling you who we are, what we do, and what are our challenges. And I hope with this, you have a global view, a good view of what you can expect from us. I'm going to display my presentation now for you. Yeah, my power. So let me know if you cannot see my presentation. No, we can see it perfectly. Thanks a lot. Okay, so and the focus of RedETSA, so what is the REDS, who we are, who conform this association, which is interested in the assessment of what we produce and how we disseminate our findings. There is a scientific technical advisory organism that was created, also a council, interregional territorial council, created in 2012, and we have agreed that we need to incorporate information for a better decision making. We are the main research on the assessment and sanitary technologies, non-pharmacological in Spain, and the idea is to provide information based on scientific data so that it's quite relevant for the decision-making process about the inclusion or exclusion or modification of this technology. Where the RedETSA ETS comes from? Well, back in 1994, there is a royal decree, or the sanitary institutions that provide health to conform or to inform for a better decision making. And it speaks about a sanitary technologies assessment group, which is actually the little grain where the red started in 2003. We had the law and in the national system. And then this assessment group started to be shaped and conform the red one in 2012, and in 2013, with another order by the ministry, the red was formally created, where all units that exist right now are conformed. But there were some initiatives before, as I explained to you.
Insignes directores que la cabeza de todos están.
And the head of all this, well, they have already provide assessment to these reports on a jointly basis. Back in 2018, the Royal Decree structures the organization chart of the Health Ministry, and in 2020, there was an initiative for what we call the Common Services Portfolio. And who we are? Well, on one hand, we have the ministry, which is the general directory of the portfolio of services, and the national directorate general of health, public health. And on the other hand, we have the agencies that are part of this, that are part of the communities, let's say, that exist around Spain, in the Spanish state. And there are some historical, there are like six, but there are other ones that it comes from Andalusia that has a big record, a long record. And we also have the National Catalonian Agency of Health and and the community of Madrid as well. Besides the 7 units that belong to autonomous communities, we have the Charles III, that is the one that organization that coordinates and assesses on behalf of the ministry. So our inspiration to conform this group of professionals of different careers, what gives coherence are the priorities of the national health system. We understand that we are the guarantors when the decision-making process in place that can affect on a cross-cutting basis of community. And we recognize that our reports and papers should be prepared under scientific rigor and should be independent from the members that work in the different agencies. We don't have conflicts of interest. And when a decision is taken, our way of working is transparent and participative for communities and all activities. So the reports that I prepare in Madrid, for instance, during the preparation are transparent for the entire network. And if there's a participation needed from other units, and that initiative is considered. We have experience and vocation of internal collaboration. That's why we think it's quite natural to reach a collaboration with RedETSA in the same conditions. We try to involve external collaboration with agents and participants of the health system of around the world, let's say professional, scientific society, patients, and even the industry. How do we work? Well, we work as a network. That means that each one of us have an autonomy and that we work around a common objective. We have statute or structure, which is the Network Council that is conformed by the Technical Secretariat and the Ministry that provides cross-cutting support to different agencies, but we have also on a rotation basis, once a year, we have a chairman and a vice president, so in such a way that the agency that is going to be the chair the following year, well, it has been a VP before, and this gives a continuation to projects, giving autonomy to the different agencies that are part of this. There is one permanent commission that is conformed by the Network Council that meets whenever it is called. It met for this webinar, for instance, and all decisions taken are taken to the plenum, a plenum of the network. There's 3 to 5 of them take place a year, where consensus is reached, of course, affecting the neighborhood. Who are the chair of the vice president? Well, correspond to the country agency. Lily, that is the chair right now, unfortunately, is going to be here. August is summer holidays, and I'd be fortunate enough to represent it. I am right now the counselor of the vice president of the network. The technical secretary, as I said before, from the ministry, prepare the annual working plan, prepare and receive suggestions for the different agencies around the world, to carry out some housekeeping to avoid duplicity, to make sure that the final version of the most pertinent one, and prepares the technical support of meeting and coordinates the function of the network. And what we do really well, what we do basically is to try to provide continuous improvement and harmonization of the process of the network, as we understand as an agency and secretary, detects the needs of the national cities and prioritizes that. Using the tools, we have the opportunity to know these tools at participate, but if not, have that in our webinars, we can tell you more about these tools and configure the management of the working plan so that the agency can prepare the technical sanitary technology reports, and we can take them to the methodology manual that are required to continue. How we do that? Well, with a common methodology and framework based on with a global perspective of the national needs of the national health system. What is our work volume? Well, normally we prepare between 50 to 60 annual reports. That for one agency would need to assume cost of staff and infrastructure, but we do it in this, if we do it in this way, it is quite harmonic and pretty present, so to speak. And we carry out methodological developments, technical and clinical assessment, and some reports, such as physiotherapies, for instance, that it was established by the ministry at the time of committee. We have reports to advise the different sanitary professionals the best practice to deal with COVID. But our work fundamentally are the assessment reports and the emerging technologies, and directed, for instance, to the decision-making professionals, to sanitary professionals, and patients, of course. And those are our three words. In function of what we type of methodology we use, well, that report has more weight or not, and patients included, as you can see here in this slide. How we disseminate that? Well, we disseminate that through a portal, a web page, showing you the URL after the presentation. Perhaps you can explore that. You can find there all the reports and clinical and methodological studies and technical data sheets of emerging technologies. It's good to know that this is going to be, and you will be able there to have this presentation, by the way, but these reports. In any event, there are reports and news that can be relevant to you, but of course, it's excellent news. Being aware of the need to disseminate, we carry out a publicity campaign, and we have display some URLs that will get you closer and teach you how we disseminate our presence. The one super important thing, and take this opportunity to invite you, are the RedETS workshops. The chairman of the Red. Well, this is kind of uh, a window to show the work, 2 days internal to put on a common basis all the activities carried out during the year, and the second day is open both for technical advisors as well as for sanitary professionals, patients, administrations, and to any person who is interested in this field. As you can see here, these titles are dedicated to those conforming structures and to deal with those things that in the year has been more prevalent. We have not, of course, worked on that. On the 2025, Lily is the organizing that. It will take place in Tenerife. It will be a pleasure to have you there, if you will. And the topic will be of the economic assessment that is, you perhaps agree, is pretty complicated. So those are that is what we are. And what challenge are we confronting? Well, we are confronting quite some challenges, and we need to get rid of them. Four projects that solves a lot of issues. The first one is strategic plan that was prepared in 2020, not in 2002. That was, and it goes up to 2025, meaning that we are just completing that this year. And we have an interesting continue working with that because it help us to, let's say, think about who we are, where we're heading to, and how to do what we do. Another important challenge that is already there is the European regulation of HTA, sanitary technologies. And Europe need to take a step forward in joint assessment, and that's been the case, has generated a regulation. Right now we are working from RedETSA with the rest of the European agencies to conform the different methodological manuals that will be part of this. And this year, we have carried out some common assignment this year, just to give you an idea, it's oncologic, but we hope it's just the beginning of a long European cooperation and sanitary technology for our member countries. On our side, the ministry has developed a project, a real decree for sanitary. There's something that can put us quite happy because it's not only Reddit, but it includes all members related and interests in technologies, and it is a real decree that, apart from laying down the basis of necessary cooperation, speaks about the future, and I'm truly delighted. And that we agreement with RedETSA. Um, the the truth is that we are pretty interesting and excited, and it's a challenge we are ready to start dealing with. From the strategic point of view, just to tell you that estamos listados to make sure that what are the challenges after analysis, it go to check the mission and vision. It was drafted by the network secretary, the strategic plan that is, and after a public consultation, it was approved. That is full of decisions and be followed up on a periodical evaluation. And you can check on it. Some agencies or some corporations, it could be useful for you to, let's say, use the methodology. And what are the objectives, strategies, governance? How are we going to manage ourselves? We all agree that is what you need to do, how we're going to provide coverage and help and support to the National Health Service in Europe as well. What will be our opportunities, strengths and weaknesses as well to do that. And of course, how to have joint participation initiatives, the benefit of being together. Of course, tensions are reduced and how we're going to give an answer to the necessary transparent. We are going to communicate ourselves with the citizenship and the population on this very important topic. We have already a mission, and that is to put the next one as a reference point, especially when it comes to assessment technology and health, to contribute to efficiency, work with all health institutions, provide support to the national authorities, European authorities in this, and this is have been, let's say, today, I've included America on the Pan American Health Organization. And the vision is what I've told you before, is to provide information that is going to support the decision-making process, to have an evaluation culture through cooperation, answering to the needs of the system. So we are cooperating with Europe and technologies, and this is quite a challenge right now. We are in that. Many agencies, part of that's Madrid, for instance, have been conforming before what we consider the seed of the European Initiative for the Assessment of Scientific Technologies. Maybe not much to say about this because there are many documents describing the strategies and methodologies of this assessment. We have many of us have participated in that, and in 2021, this European regulations come into place and was adopted with the procedures for cooperation as well. The vision is to improve the access of patients to the innovative technologies, avoid the duplicity of member countries, ensuring efficiency, and include the generation of evidence to provide sustainability on the long term of the European countries really with a huge vocation for public services and national health systems that are part of all this. And what are the main elements here? Well, the main that are inspire our network, joint work on clinical scientific aspects oriented by the needs of member states with a corresponding quality, adapted to times and transparent, and guided by scientific evidence as a main tool to guide the decision-making process. We are going to rely on joint work. That is to say that when new technology is assessed in one of the member countries, part of this national plan, that knowledge and that scientific evidence is applicable to all countries. It's done in a cross-cutting basis so that it can be useful to all member countries to decide the implementation or not of that new technology. Member states will continue to be autonomous and responsible and drawing the conclusions that will be part of their health systems and to the decision taken about price, funding, and implementation. And vocation for the participation of all stakeholders and the progressive implementation without, of course, saying interference. And I wanted to mention here the joint assessment of sanitary products class 2, class 3, among others. So this is governance. I'm going to leave that with you in case you want to analyze it or read it, but it's not, not necessary to assess that right now. And that is for your information. Then we have the Royal Decree and the scientific technologies and administrative decisions on the incorporation, refund, and cost of these technologies. And truly is a work about which we are very happy and thankful to the and right now is ready for the approval and is going to guide the work and the network with the support of the population. And then this agreement, you, Alexander, have mentioned it, but I think that cooperation, let's say, there were kind of little sprouts of this in the beginning. The agreement that you have now, this MOU is kind of a backup to conduct webinars like this, for instance, to have participation in different encounters and collaboration in the development of training, shared in the report through beta or through the different streams that we can put in place, mutual support to the revision of many systems, exchange of traineeships, internships, sorry, and then joint work for training that we have had already some good experiences. Some of the participants in this webinar participate in one of the courses we have in RedETSA Aware Network, and I'm happy to see you here. And our hand, this is all. On our side, this is all. And thanks for all of you to have participated and giving me the opportunity. Thank you.
Thank you so much, Blanca, for sharing with us the experience of the Spanish network. And it's a network that's concentrated on medical devices. I know it's very important to get to know as members. Surely our agreements and our cooperation agreement will give a lot more opportunities. And we have for March next year a technical visit to Spain to get to know more closely about the experience of the agencies of Spain. So thank you so much. And we will continue. And I want to say, since I was so excited and with my excitement, I forgot to follow the script that my team had prepared so carefully, because I should have, after the homage, I should have handed the moderation. So I will hand the floor now to Adriana, and then Vania will be moderating. I apologize. I got really excited and I changed the script a bit. So Adriana, we now hand you the floor so you can do your presentation. And then Vania will be doing the moderation. Adriana, thank you so much for being here with us. This is perfect timing that we were able to do this webinar on this matter with you here with us. We are so, so happy. I hand you the floor. Thank you so much, Alessandra and Blanca. Your presentation was wonderful, and it's wonderful to see the power of collaboration and how we can share information to get to all of our patients wherever they are. Thank you, Alexander. And can you see my presentation? Yes, we can perfectly well. Okay. Yes, yes. We can see the second slide. Okay, perfect. Thank you so much. I already had some water. I'm feeling better. So thank you for your kind words. It's an honor to be able to be here. And first of all, I want to thank you for your invitation to such an important meeting, and that everything matched in these times. As Alexander said, it's very emotional. And I'd like to share with you what it is that we're doing in the new publications. And I apologize, I'm a bit excited and altered, but you have the schedule, the agenda here, and let's get started. First of all, let's see how we focused the evaluation in technologies. And I apologize if there are some words in English and in Spanish in my slides, because it's been very busy day, so I wasn't able to translate all the slides, but we will be sending them to each one of you. So first of all, in the sequence of innovation to use, how does the sequence of technology assessment start? And I know you're all subject matter experts, and I just like to emphasize on the fact that in the documents that we have that were published recently at WHO, and we added a column on the left that you can see, and it's the nomenclature of the medical devices. And as Alexander said, it's been something that we have really emphasized on, and we were finally able to reach an agreement to be able to use the GMDN and the MDN as nomenclature, and maybe better harmonize the information that we have and being able to share it, because in medications it's very clear. They have the names and the INN, but in medical devices in different countries, we call them in different ways. So if we could harmonize and put the nomenclature within the classification of all these guidelines and evaluations that are done for technology for all of us, it would be wonderful, because then we would be able to have a much better source of information. Of course, we have the role of academia and the industry, and all the books that we have of the WHO related to academia and industry, they're in red. I'll show you. Then everything related to the regulating entity is in green. Then technology evaluation is pink. And then finally, technology administration or management is everything in blue, because it's part of the health service that will be implemented to say from the purchase to the acquisition to finally the user at the health system. And we have a comparison of some that say, I evaluate nationally or at hospital level. So ideally, as you all know, it's better to evaluate nationally, to look at the list of benefits of the insurer, but it could also be locally. And then it would really be about seeing the evaluation with the clinical and biomedical engineers and the clinical personnel and financial personnel. Here you have the entire series. We go from this, that are the blocks, to the colors of the books. The book on policies, we are about to publish it. I think it will be published in September, and we will be sending it over through RedETSA, and we have the Atlas Forum, and we have the list of human resources for medical devices. We have the part on regulation, and here we have evaluation and technologies, which is a new book that we just issued 2 months ago. And this is the book that allows doing the classification for all the devices that are a priority or listed as essential for in vitro diagnosis. So this is what the methodology regulates, to be able to issue these books and make them available for the countries. And then in parallel, after having selected these priority technologies, we're going to put them on the side of technology management or administration. And I know that you can't read this, but it's so that we can do the evaluation of needs, the purchases, the donations, inventory maintenance. And this book on inventories is also new. It was just published 2 months ago. One thing that's really important, and I'm pleased to have heard Blanca, everything that's been done on the evaluation of technologies, but also how do we compare this with the regulatory part, and what part could be common so as not to double efforts on part of manufacturers or on part of evaluators. So as you all know, we have security, a safety quality evaluation, and then effectiveness, so that we can end up getting to prices and conditions. And we put this in these colors so that we could also evaluate one by one and see how we could join our efforts and not double the efforts. And of course, I'll be sending you the set of these medical slides And what is the role of the biomedical engineer? And then as biomedical engineers, we can have design, evaluation, management, locally, regionally, or globally, and interacting with the clinical area and the health economists and everybody else for the evaluation of technologies and health. And one thing that we always, or I always keep in mind, is that we talk about the evaluation of technologies, and the countries that have more technology evaluation agencies are the ones that have more resources, when at the end of the day, the ones who need them the most are the ones who have the least. So this is something that I never forget, and that we have it here because for countries in emergency situations and disasters and everything, we have to have these medical devices for emergencies, for disasters, and then going to essential technologies, and then, of course, from them go up in the levels of attention and complexity to very complex technologies. But how can we ensure that this first basis has the medical devices and the technologies that the population requires? At the WHO, what we've done is using the evaluation of technologies and taking data from priority medical devices and from the lists of the in vitro essential diagnostic tests. So all of these, we had so many books that they said, Resolution 6029 said there needs to be a database. So the idea is to put this database so that all the information is there, and it's so much easier to update it and to do searches. This is called MEDEVIS, Medical Device Information Systems, and it doesn't only have medical devices. We also add technologies for assistance, and we also add consumables for calibration, because it couldn't work necessarily well like this. And here we have the books that we issued: reproductive health, cancer, COVID, of course, when COVID came in, cardiovascular. But we've been adding more, and in 1 week, I hope you can see the new one that has tuberculosis and some other diseases or health conditions. All of these following the technology evaluation aspects, and we see the area and the clinical guideline practice and the evidence, and then we have an experts committee, and then it's published in the book, and then we go to the database. But what is interesting is that in the book, they're already divided per the levels of attention. And we have first level of attention, second level of attention, third, divided into which are the diagnosis or for treatment. And then based on this, we did the MEDEVIS. When you go into the MEDEVIS, you can go in and see what type of level of attention, and you can filter. And in the part of essential diagnosis, it's very specific that we look at equity, human rights, ethical considerations, cost effectiveness. And when we have this information, as you all know, there's very few information available for the in vitro tests as well as for other medical devices. And the idea is that the WHO does the studies, and then we send them to the countries. And as you all know, with the committees, with the national committees, it's where we put the medical devices, and deciding if it's first, second, or third level. Let me give you an example of the resolution of diagnosis that was approved in 2023, because it specifically has the area here, number 2. And sorry, the blue ones are the ones that were in progress, and the yellow ones are the ones that, where we have the coalition of diagnosis. But there was one that says doing technology and evaluation systems for diagnosis. And these diagnoses are not just in vitro, it's all types of diagnosis. This is what Pablo was talking about, and here we also have the way how to do the priorities of medical devices and how you have these policies and prioritizations in the member countries. The resolutions have the two parts, what the WHO does and what the member states do. So we put this in the databases, we put everything that's in Medevis, everything that's in the essential diagnosis, but here we put a new one, which is which groups everything needed for a clinical intervention. Because we had one by one the equipment here, and we are grouping them for better clinical interventions, but here also, upon request of the resolutions uh, that are using these databases in such a way that one diagnostic test requires a medical device or some reagents, and these lists are related and matched one to the other. And then we also added a section of innovation products. We have the web pages that are being updated constantly, like the one of medical devices and diagnosis, but we also have the technology evaluation, where there's a lot of information in technology evaluation, not only for medical devices, and then for everything related to innovation. As you know, we did the compendium of innovation for low resources situations. And I'm just going to show you the diagram where we say what it is that is assessed, the regulatory aspect. And then, as you can see, colors are the same. We assess the evaluation of technology. We evaluate the legal, social, scientific, and ethical aspects to know if an innovative technology can really be applied in a specific situation. Then we add the part on management. So I'm just showing you this so that you can see how this is a link for evaluation of technologies, but how this should be used along the evaluation of products. And here we have in this book everything related to technology assessment. And then here we have the comments for each specific product. And you can see in the colors if it was approved or not. And recently, in June 2nd, we had the Global Forum on Medical Devices. We had these sessions on technology assessment. And very shortly, we will be sharing the report and the recording so that you can see them, because we could exactly see all these sections on innovation and regulation and evaluation one by one, and then all together in the lists of the medical devices. And now we see the future, which is health records of health workers. And when we look at sustainability, which is very important, emergencies, and also we added artificial intelligence, because this is what comes next, but we have to consider everything. So then this is my final slide, and it's that the vision of the technology assessment in health for medical devices provides information for decision making, but always considering what I was telling you about the patient, for the well-being of patients at local, regional, and worldwide level. And the idea is how we all have to work together with NGOs, professionals, academia, governments, and of course, all of us who are here. And I put a baby specifically because we have a huge responsibility for the coming generations. Thank you so much. Thank you so much, Adriana, for your excellent presentation on the document that was updated from WHO for medical devices. And it's great to have you here with us. But I know you will be continuing after you retire, continuing with us. So before we go to the last presentation, the last speakers, I want to remind you that you can ask questions in the chat box or the Q&A box at the bottom of the Zoom screen. We are going to be handing the floor to the presentation of the final presenter. She's a biomedical engineer of University of Valparaiso, Chile, with a master's in health economy from York University in the United Kingdom. And she's currently a researcher of the TS unit of the Ministry of Health of Chile, and she's part of the working group of medical devices. And Victoria will be presenting the advances and perspectives on the region of the Americas. Good morning, Victoria. It's a pleasure to have you here. The floor is yours. Good morning, everyone. Before I start my presentation, I'd also like to thank Adriana because she is a source of inspiration for all of us here in Latin America. And can I share my screen? Yes, yes, you can. Okay. There you can see my presentation, right? Yes. Okay, now I will be presenting our progress and a little bit of the history and what's coming next for the working group on evaluation of health technologies for medical devices. This is a part of one of the working groups of RedETSA, of the Network of Health Technology of the Americas. And here we have Veronica Gallego, who's also here in this webinar. So how was this born and where did the idea of the Working Group on Medical Devices come from? This started in one of the annual meetings of RedETSA in November 2019 as part of a situation that several of the participants of this network that we had agreed. We were all colleagues, of course, biomedical engineers, and it starts with this doubt on how can we do technology assessment focused on medical devices, understanding that these are very different to medications. In the coordination, we have Veronica Gallego from Mexico and myself from Chile. In the methodology, the working methodology has always been through online meetings between the in-person meetings that we have in the network. So how has this working group been evolving? When it started at the end of 2019, then evidently we had the pandemic. So it was paused a bit between 2020 and 2023. And during that time, there were close to 10 members of 7 countries. In 2024, when the pandemic ended, the number of members increased and more countries as well. And in 2025, a couple weeks back, in July, in the RedETSA meeting in Buenos Aires, this interest for the group on medical devices came up again, and through a survey, those who answered the survey were interested in participating, and we reached 29 members who respond to 15 institutions from 13 different countries in the region. Now, why is it necessary to have this HTA group for medical technology assessment in medical devices? Because there's a lot of variability of medical devices globally, over 2 million different types. They have specific challenges compared to medications. There is a regional need for specific methodologies because, of course, in general, we all have knowledge on the methodologies of health technology assessment, but it's necessary to make some adjustments for medical devices. And the other thing is that the change, the technological change for medical devices is very quick. Because there's one model, then another, then another. We have to try to give an answer to the situation. And evidently because we have to respond to financial sustainability of the health systems of our country. So what are the limitations for medical device assessment? And this is the clinical evidence. There's a lack of clinical evidence for medical devices. For example, in certain situations, studies can be biased. There are some procedures that are invasive. The election of comparisons is very complex, and this can also affect the size of the sample. There's a lot of heterogeneity between the difficult classes, and they can be classified depending on the risk. And many are from multiple indications, and within the indications, there are different values or magnitudes of efficacy or effectiveness. And there's a dynamism in the models of the devices, and many of these, and they have a high impact on the infrastructure and the organization of the health institution, which makes the assessment much more complex. And we also have the fact that the procedure also has to be assessed. And here we have to see the clinical devices performance and how the costs are going to impact depending on the type of procedure executed with a device. And the other situation that we have to consider in several medical devices is the learning curve. And it's associated to the use of medical devices, which will be affecting the way that we measure the effectiveness or efficacy of the device. This was more in context on how difficult the medical devices are. But what have we done as a group? As we were saying at the beginning, this idea came up a little bit before the pandemic, and then the pandemic delayed the advance of the group. And then also there's situations that are a bit more complicated that we have to learn to overcome, which is the challenges of working as a network. That, for example, we have the advantage of the fact that we speak the same language, but there's different time zones and we have to coordinate those types of situations. And this has been a challenge, of course. But regardless, last year, the group got a request from Adriana Velazquez that we should comment on this document that they presented. So there, as a group, worked in meetings, and then we replied and we suggested and we sent the comments for the review of this document. And also during this time, we worked on a manuscript, which was a systematic review of the literature that took us a while on the perspectives for the evaluation of these technologies for medical devices in Latin America, where we did a methodological review. The main results that we found were that there isn't a literature that addresses the situation of medical devices in a comprehensive manner. There isn't like a full recipe. As you've seen, there's different ways of assessing them. One of the suggestions that we made is that we could, through a classification, through a taxonomy, we would recommend based on this to check and see how relevant it is to have a technology assessment, and there needed to be availability for medical devices. And it's been available for a while. The tool is called Cheers for the economic evaluation, and it adds 4 items. And that there is a greater challenge for medical devices, and it's how the value framework, how did the agent develop the value framework? So this It's part of one of the great work that we did here as a group. Now, what's next? What are the next steps of this work of the group? We did a survey, which was published from July 28 to August 11th this year. And these were the main results that we were able to gather. Within the interests that the members indicate, we were able to group them in these 5 that you see here. And the main interest is the application of HTA for medical devices, the methodological development of standards, promoting harmonization and technical cooperation between the member countries, reviewing regulatory and organizational aspects, and then finally, sustainability and digital health. To delve into each one of these matters, where the members suggest we work is on health technology assessment applied to medical devices, integrating the evaluation of these technologies in clinical regulatory and coverage regulations, promoting responsible innovation of medical devices through assessment. And one thing that's also important that comes from the world of engineering, and it's incorporating the patient security aspects in the use of medical devices. And it's also very necessary for the members of the group of the development of the methodological development, and maybe we could there advance in drafting and standardizing types of assessment reports for medical devices and defining methodologies for the analysis of the available evidence, establishing prioritization criteria, and developing different types of tools and processes and regional guidelines adapted to context with limited resources, harmonizing and doing technical cooperation. And I think that as Adriana was mentioning, we've advanced a lot on this, and maybe we could link to what was already done with the work done by Adriana and promoting the harmonization of methodologies and strengthening technical cooperation between the regulatory agencies. And another important aspect of the network is sharing the experiences and methodologies and application cases and that different members have had, learning about and comparing the regulatory frameworks on medical devices, because there's great heterogeneity in the region. So it's impacting to see the differences and the different levels and the different countries of the region. One thing that I think you've all realized is how to assess emerging technologies like medical software, AI, and artificial intelligence, which is already here, and that is very much linked to medical devices. One thing that we cannot forget about is to analyze and integrate the analysis of the organizational impact and the necessary equipment for decision making. And in regards to sustainability and digital health, thinking towards the future would be including the environmental impact of the assessments of the medical devices. In some cases, maybe they value the use of, or they assess the use of medical devices. These are situations that are very complex, and in some scenarios, it could be interesting to assess. And incorporating digital health trends and digital medical technologies. Here, now, the members of the group already also suggested ways for methodologies and how we are going to organize this. And they mentioned that we can have spaces for exchange and training and webinars that are online and regional technical collaboration. So for example, they requested a quick notification network and strengthening of cooperation between countries and collaborative review of existing methodologies. This is also as part of what's being requested. an analysis and collaborative evaluation, a grouping of medical devices per type of technology, risk classification, and others, because given the amount of devices, we understand that it's impossible to assess two, and that we have to make decisions based on some sort of classification. We can't assess all of them. Now, we also have to think which will be the goals, what it is that we are going to produce, and some of the ideas are technical and methodological documents, developing support and guidance material, or even trying to do a specific assessment that is of common interest. Now, for all of this, the group will define it in a meeting that we are going to be having in 2 weeks, where we will be starting with this new stage, the group of medical devices that has grown a lot. And with this, I thank you for everybody here for the interest that you have in the assessment of health technologies based on medical devices. Thank you so much. Thank you, Victoria, for your excellent presentation and for representing the medical devices group as well. Now we have a very short space for Q&A, so I'll be asking the questions together, and you can please respond or go to our closing remarks because our time is running out. So here we have a question of Paulo Lopez. What change do we have when the medical device is a software as a medical device? It's a scenario of deep digital transformation accelerated by the artificial intelligence and mobile devices industry. And how can we have the speed to assess health technologies that protects people and patients? I understand distinction between the applications in general in the health environment of medical attention, but this separation is much more complex with an avalanche of offers. So the other question here is, where is it? Here, Eder Herrera. What has been the progress specifically in regards to the digital health evaluation? What frameworks or recommendations should we keep in mind? And for those of us who work in research and development on this, and there's also a question, and what's the clarity with software medical devices, especially those that incorporate artificial intelligence? And then we go and see whoever wants to reply first. And who wants to do the closing remarks? Adriana, Blanca. Yes, of course. Thank you so much, Vania. I just want to reply really quickly. I put it in the chat. There's a lot of technologies that are called digital health or e-health, but we're only going to consider as medical devices those that are going to give a clinical data, being it for a diagnosis or treatment. All the rest go into another area. And I wrote in the chat the link to a regulatory consideration on artificial intelligence for health, but this also applies in the area of technology assessment. But this is surely something that will move really fast and that we have to move really fast with. And I just want to clarify that what I presented is on the policies, but everything related to the development of the methodology, I agree with Victoria, and we still have to develop all of that together and then make it available for everyone. Thank you so much. Thank you, Adriana. Blanca. We can't hear you, Blanca. Okay, no, I just want to say that from RedETSA, we felt the need and we've published in the framework of technology, health technology assessment and adaptation for these digital health technologies, and we're very proud. This has been led by Aqua, the agency within REDETS, and we want to start a path so that we can select, as Adriana was saying, the technologies that should be assessed and let the rest permeate in these systems without us having much to say, and clearly identify and learn how to assess the technologies that are going to be redundant on the patients. And I just want to thank you, and um, I'm available for any other initiatives that you consider. Thank you so much. Thank you for your presence. The document that Blanca mentioned is available to the RedETSA site. It's interesting and important for us in the region, and we're still developing these methods, and we need to advance a lot. Victoria? Yes, I was actually going to say the same. This document developed by Aquas has been an example and a pioneer in digital health technologies. And actually, here in Chile, we are working on a sort of adaptation so that from Chile's perspective. So we hope that in a few months it will be published already, because it's something that we've been working on for almost 2 years. The Ministry of Health of Chile, with the CENS, which is the Center for Health Research in our country. So we are very thankful for the contribution as well. Blanca, would you like to say something? Yes, I just want to encourage Victoria from Chile to make this adaptation and give you all the good vibes that you need, and that it should happen like it happened to us, that we started adapting. And then I said, leave us with your framework because it's fantastic. So we're waiting for Chile to improve the framework, and we can all use it because that's what it's about when we talk about working as a network. Adriana, do you want to say anything to close? No, I just want to wish you all the best and to keep working together, because only if we're together and contribute and collaborate together will we be able to find a good solution. And somebody was saying if it's harmonized or not, well, all types of medical devices will be different, but it's very important to share the information. And this is the only thing that will really be able to help us better assess medical devices. But we're so happy to be talking about medical devices in this meeting because they're indispensable in the health services, not only for diagnosis, but also treatment, protection, rehabilitation, etc. And thank you so much. Let's never stop thinking about our patients, which will get benefits from what we're doing. Thank you. A very happy day for us. So let's close our webinar. Thank you so much, everyone here. Adriana, Victoria, Blanca, Alexandre, Pablo, Veronica, all our colleagues, Mariluz, all of us who are here in such a happy day. And we are really happy to say that the next webinar of RedETSA will be on dialogues of artificial intelligence and ETS and opportunities for innovation and collaboration. It will take place on September 12th, and it will have the participation from England and the HTI Society. In Brazil, we'll have a Federal de Minas Gerais that will be sharing key perspectives on the role of artificial intelligence. I now hand the floor to Alexandre, who was very excited to be doing the final closing. I know he wants to talk. I've known Alexandre for over 20 years, and he is so happy today with Adriana and everybody else here. Thank you so much. And I apologize for not handing over the moderation from the beginning. This is a full day of excitement. And I'm not going to say much more. I know it's a pleasure to have had Adriana with you today and to have the opportunity and the honor. And I know that you're having a lot of homage there. There were other meetings also that I couldn't participate in yesterday. but we're happy as a team, as PAHO and the Department of Technologies, and happy to have been able to participate in this set of homages that are very well-deserved, and we don't do justice to everything that you've done. But we are going to keep collaborating with you. But it's a chapter that's closing, that you have to be very proud of for everything you did and everything you're still doing. So we're so happy to be able to participate in this celebration, because I know we have to celebrate. It can be a bit sad sometimes, but I know we have to celebrate, because when we do these concrete things where there's impact on people, we have to feel very proud, and you should be. And we are proud of you as well. So thank you so much. Thank you, Blanca, Victoria, for your participation, for your presentations, and thank you to all the participants. We had over 300 participants, and everybody has a lot of interest on this, and we'll keep undoubtedly working with the members, with the guests, with the next webinars, and hopefully, Adriana, and in the close future, we can have you again here with other roles and other challenges that you're surely going to have, because you are an engine, a driving energy. And so you'll surely keep contributing and working together in the future. Thank you so much, colleagues. Great weekend to everyone and to your families. Thank you. Bye-bye. Thank you. Very exciting. Bye-bye.
Gracias, gracias.